Ladies and gentlemen, welcome to the Health and Wellbeing Board. Today, the 20th of November 2025. This meeting is being live streamed and recorded. Members of the public will be able to see this meeting and hear the audio. And so, members and those in attendance, can I go around the room and ask you please for your name, role and your organisation. Thank you very much.
Thank you, Chair. I'm Rachel Robinson. I'm the Exec Director with also the Director of Public Health. I'm a joint role that I work with the ICB and I am currently interim Chief Exec as well. I missed that out yesterday.
I'm Councillor Heather Kidd and I'm leader of Shropshire Council.
Hi, I'm Jackie Jeffrey. I am the Chief Officer at Citizens Advice Shropshire, but I am also the Vice Chair of the Voluntary Community Sector Assembly. So I am here representing the sector.
Thank you, Jack.
Hi, yes, I'm Peter Tezard. I'm the Chief Executive Officer of Energise Shropshire, Telford and Wrekin. For complete transparency, I'm also the co-chair of the Voluntary Sector Assembly Board.
Thank you, Pete.
Good morning, I'm Ruth Harrington. I'm the Councillor for Bishop's Castle and the portfolio holder for social care, which covers adults and children.
Thank you.
Good morning, colleagues. I'm David Shaw. I'm the Director of Children's Services at Shropshire Council.
Hi, Helena Williams, Youth Support Team Manager, Shropshire Council.
Hi, Natasha Nugent, Assistant Director for Shropshire Council, working on children's services reforms.
Thank you. Hi, I'm Alison Davis. I work for Midlands and Lancashire Commissioning Support Unit and here today to support the item around National Neighbourhood Health.
Thank you, Alison. Welcome.
Thank you.
Hi everyone, Naomi Roach. I'm the Health Population Lead for Shropshire Public Health and also the National Neighbourhood Health Implementation Programme Local Coach for Shropshire.
Thank you.
Hello, I'm Lynn Corley, Chief Officer at Health Watch Shropshire.
Thank you.
Good morning, Nigel Lee. I'm the Chief Strategy Officer for NHS Shropshire, Telford and Wrekin and also a joint role with as the Director of Strategy for South.
Michelle Dulson, Committee Officer for Shropshire Council.
Thank you, Michelle. And move to the, those online. So, Mo.
Sorry, was that myself?
Yes. Sorry, I'm not
Good
talking.
morning. Good morning, I'm Mo Lansdale. I'm Chief Superintendent, Local Policing Commander for Shropshire and Telford.
And Claire.
Good morning all, I'm Claire Parker, Director of Strategy and Development at Shropshire, Telford and Wrekin ICB.
Thank you, Claire. And Chris.
Hi, I'm the Finance Business Partner that looks after health and wellbeing and the public health.
And Ben.
Good morning, Ben Hollands. I'm the Senior Public Health Manager at MPFT.
Thank you very much, Ben.
And apologies, can I just correct my title? In one of my titles, I got that I'm Interim Deputy Chief Executive, just to make that really clear. So thank you.
We did wonder.
No, I knew.
Thank you. And so apologies have been received from Simon Whitehouse, Chief Executive Officer for Shropshire, Telford and Wrekin and NHS Staffordshire and Stoke-on-Trent cluster. From Claire Horsfield, Director of Operations and Chief AHP, Shropshire Community Health Trust, and David Crosby, Chief Officer, Partners in Care. May I remind members to disclose any pecuniary or other relevant interests not already recorded in the register of interests and to leave the meeting prior to those items being discussed. Does anybody have any declarations? No, thank you. And so we move to the minutes of the last meeting. Can I ask for any amendments to the minutes of the last meeting? No, thank you. And so I move that the minutes of the Health and Wellbeing Board meeting held on the 18th of September 2025 be signed as a correct record. Can I have a seconder, please? Thank you, Ruth Houghton. And so a vote, please. Favour? Any against? Any abstentions? Thank you. And so I'll sign those at the end. And so we move to the next item, which is public questions, and there have been none received. And now then we move to the main item for discussion, which is the National Neighbourhood Health Programme Progress Update from Naomi Roche, Public Health Principal, Shropshire Council, and Alison Davis, National Neighbourhood Health Improvement Programme Coach for Shropshire, Midlands and Lancashire CSU. And the board is asked to note the content of the brief. Thank you, Naomi.
Thanks, Bernie. Thank you all. Obviously, Alison, Ali and I are here to talk to you about the National Neighbourhood Health Implementation Programme and the work that's happening in Shropshire. And as an introduction, I wanted to give a bit of context in terms of our application to the programme and the reasons and rationale behind that and what, as a local area and place, we're looking to achieve from the programme. In summary, our application, as much as it wasn't titled as Tackling Rural Health Inequalities and Advancing Integration in Communities, it's very much the main theme of the application that we submitted. We submitted an application along with 141 other places across the country, and we were one of 43 that were awarded a place on wave one of the programme. We are really clear in terms of the direction of the work that it is very much enabled through the strategic priorities of the Joint Health and Wellbeing Board and the SHIP key priorities and the alignment with the National Neighbourhood Health Goals, so that advancement towards the delivery of the 10-year plan. Just wanted to give a bit of strategic context to a lot of you. This will be quite familiar. We have done a lot of work over the past few years in relation to the previous Shropshire Plan, Shropshire Health and Wellbeing Joint Forward Plan, but also the Joint Health and Wellbeing Strategy, and looking at how the prevention framework and One Shropshire delivers that. And this is very much about us as a local area working together, really enhancing outcomes for people living in Shropshire. The outcomes and ambitions of the programme very much align with these, and we are using the SHIP priorities as one of the enablers to delivering this really clearly and done in partnership with Health and Wellbeing Boards. Those key priorities for SHIP were and are around the delivery of integrated practitioner teams, the development of community and family hubs, and prevention at its core along some very, very key areas. So ageing and frailty, housing, children and young people's mental health, and diabetes. And those priorities really align quite well more broadly with those broader population health issues that we are concerned with, but also the health priorities in terms of our system. In relation to our aims, thankfully, and not without a lot of thought, the aims of this programme very much align with the Joint Health and Wellbeing Board strategic priorities, very much about improving population health, joined up working, collaboration, working with our communities to develop strong and vibrant communities, enabling our community and voluntary sector in terms of that leadership role and partnership position, and really reducing inequalities. There's a lot of work, as everyone is aware of, and some may not be as familiar with, that we really need to look at developing and really looking at delivering better outcomes for our residents in Shropshire, and taking into consideration the rural geography and the challenges that we have there.
This programme is very much, and Ali will talk in more detail about this, but this is really about building the foundations to enable large-scale change and transformation. It is about bringing partners together and looking at what's working well, what we need to improve, and how we can work as an integrated system to embed prevention, a population health approach at improving outcomes for our residents. We have a lot of community assets, a lot of neighbourhood assets, a lot of resource and workforce assets, and we really want to enable those to really deliver as best they can in the challenging times we are all working in. So hopefully that's given you a bit of context, a bit of background in terms of the aims of Shropshire and what we want to achieve and how it aligns strategically with our priorities. But I'm going to hand over to Ali, if that's okay, and she's going to talk to you about the programme itself.
Thank you very much, Naomi.
Thank you, and thank you for inviting us to talk today, because we're really keen that this programme is as wide-reaching as it can be across Shropshire. So the concept of neighbourhoods and neighbourhood working has really been around for many years, hasn't it? And many, all of you, probably many of you will have been working towards this. So this slide, I always feel a little bit of a fraud saying, what is neighbourhood health, sir, by Ali Davis? But this kind of outlines there's various ways that neighbourhood health is interpreted by people, organisations. So the national programme has defined neighbourhood health with these three kind of underpinning areas. So firstly, it aims to ensure that we start to move away from that very kind of biomedical model into more of a psychosocial model. So wrapping the care around the individual that's right for them. And we've talked about it for some time, haven't we? Empowering people to take control of their lives and their health. And that really underpins the neighbourhood health programme that we're trying to do. And moving on to the second area, this is very much around working in the prevention space, looking at further promoting health and wellbeing, and doing that, moving into the third circle, doing that through the communities that people are living in, and building on their trusted partnerships that they already have, be that community groups, be that general practice, their opticians, their village halls, whatever those kind of trusted partners are, how can we support health and wellbeing and that wraparound care through that community resilience? Now, as Naomi said, we are one of 43 areas across the country that have been selected onto Wave 1. The national programme specifically selected those areas that were already the most progressed in their thinking and delivery around neighbourhood health. So we're very fortunate in Shropshire to be on this programme with people that have been delivering the model around neighbourhood health for some years and have seen some tangible outputs and improvements with their population as a result of that. And we've got a lot that we can share from Shropshire, but also learn from others. And there's many case studies now that show what those measurable outcomes are for our populations around working together in this integrated way. So the programme itself, Shropshire are on the programme for 12 months, and it's aiming to do all of those things. The slide hasn't moved on. Apologies. Seem to be stuck on the slide. Thank you. Yeah. So the programme itself has aims that very much tie into what Naomi's talked about in terms of Shropshire's priorities. And there is an initial kind of immediate focus for year one around just looking at some of those complex individuals with multiple long-term conditions and rising risk of requiring intervention, crisis intervention, be that council services, adult social care, or health services with non-elective activity. So a rising risk of needing to use those services over the next 12 months. So we're working with our neighbourhoods to really focus in on those populations. The programme essentially is kind of running two tiers alongside each other. We know that for us to achieve the ambitions that we want for Shropshire through neighbourhood health, it's going to require a culture shift, working differently, some long-term infrastructure changes, be that the way our workforce work together, the way funding is distributed to our partnership services. And some of those things are going to take some difficult conversations, some difficult work through. They're things we've not achieved yet. And it's really important that this programme tackles some of those harder to do areas. Alongside that, we are looking at doing some kind of immediate work, and that's the work we've already started with our neighbourhoods. So immediate work to look at our populations that we most want to support in the immediate term. For some of our neighbourhoods, that focuses around those priorities Naomi outlined around frailty, and a couple of our neighbourhoods are looking at that real kind of rurality and the challenge around isolation. So that's going to be our initial focus for the programme. Apologies that we haven't got the slides. I'll keep talking and we'll make sure they're available afterwards if we can't get them earlier. So as I said, there's many areas on the programme that have been kind of working on neighbourhood health for quite some time, and we've got lots that we can learn from them in advance of our work. And many of the messages that are coming through from those mature neighbourhood areas is around the importance of that integrated relationships and partnership working, having a joined up, integrated understanding of population need. So from a local authority perspective, we might have a really good understanding of our own citizens and residents. From a health perspective, we might have a really good understanding of the health needs. And from a voluntary sector perspective, we might have a real good understanding of what our populations need. So bringing all of that intelligence and knowledge together alongside our residents. And then looking at what services we've already got in place, what skills and capacity we've got in place, and starting to remodel, taking down some of those kind of organisational boundaries that we might have been constrained by previously to be able to work together. So on the bottom of this slide here, you can see this is what we're working towards, developing a joint work plan with shared governance that feeds into those kind of already defined SHIP priorities, making sure that we're working in a fully integrated way and looking at those new ways of working. There's various existing national guidance that's already out there that's leading us towards this. So neighbourhood health features heavily in the 10-year long-term plan. From a health perspective, we've just received the medium-term planning guidance for the remainder of this financial year, and we've got the strategic commissioning framework. All of those already support us to work towards this model. We're expecting by the end of November the model neighbourhood framework that will give us more detail around how we, as groups like this, as leadership teams, support our communities to work towards this neighbourhood way of working. And that is expected to also include what the role of the Health and Wellbeing Board is in supporting neighbourhood health. I'll skip on from this one, Naomi, because I think I did that as the slides were stuck. So just a little bit of an update on local progress. So we have a team of 18 people from across all of our partnership organisations involved in this work, including voluntary sector, health and council services. We have already kind of had a national event and a regional footprint where we were able to hear from more progressed areas. And then we brought that learning back to Shropshire and ran some workshops last week to really start to define what the local delivery is going to look like. And that's very much in that partnership way. We are doing a series of stakeholder briefings and kind of said, I'll talk to anybody that will listen about this because for me it's really important that we get into all the groups and organisations that support this work. So just to close, I guess I wanted to summarise the role or the ask of the Health and Wellbeing Board in this programme. Rachel Robinson and Lorna Clarkson, Chief Medical Officer for the ICB, are both our senior responsible officers, so we will be seeking direction and support and escalation through that route. But the Health and Wellbeing Board are asked to kind of review these considerations. So what we will look to for the Health and Wellbeing Board is that strategic leadership and alignment on this programme to help us on the journey of our culture growth towards partnership working, even when it gets difficult. To ensure that we've got a common voice and a collective message across all of our organisations. If we're not speaking as one voice across our partnership, we're going to have challenges. My language here, unsticking the sticky stuff. Things are going to get difficult on this programme, aren't they, if we're going to really change the curve. So we'll seek support from you around this, and we do expect that there will be some structural changes that we'll need to make across our partnership organisations as we get further into this, and we'll look to your support for that. And I'll close there and hand back. Thank you, Bernard.
Thank you very much, Alison. This is an exciting time where we're hopefully going to make a modal shift, and as you said, go from the biomedical to the psychosocial and related models. And so I'd like to open up the paper for discussion, and I think Rachel is wanting to have the first word.
Thank you. Thank you. Apologies, I didn't share that in the right way as well. I don't think you see on the public stream, but we can share that after. I think I just want to reiterate, I think, some of the point of this, and I guess of the way that the agenda has been shaped today, is that it is about knitting all of these programmes together. Health talks about neighbourhoods, we talk about places, we talk about communities, lots of different definitions and slightly different geographies within that. But I think fundamentally we started on a journey through the Health and Wellbeing Board and checked out actually the importance, particularly in a rural area such as Shropshire, if you really want to tackle inequalities, if you really want to support communities, everything needs to happen as close to people as possible. And that's what we set out to do in the work that we've been on. And I think you nicely showed that from the thread of the joint strategic needs assessment, the strategy, and then into the SHIP priorities. We've talked about the importance of our communities, the importance of wrapping services around, whether that be adults, whether that be children, whether that be our assets. How do we really maximise that? So I think your bit around that, us having that strategic steer as we go through all of these papers, and we'll keep bringing this back and helping to shape through our organisations to knit that back together, is really important. I think because actually there's a real lot of opportunities to align all of these programmes, and whether that be the wider determinants that you talked about, the kind of things that support people, we would call that, or whether that be actually the direct services. So I think it's a really exciting opportunity. It's really great to see that we've got additional capacity resource. I know we haven't actually got any necessarily with that, but I think I just like to emphasise, I do believe that's our role as we've been through the months and we see the work that's being done by teams. Our job is to keep knitting that back together and to make sure that it's shaped. And then obviously a huge part of that is the partnership and the culture that we've tried to foster through the board into all of our organisations, but also because people are looking to us around the leadership around some of this. I think fundamentally in this, it gives us an opportunity, and I know we've said it through SHIP and others, haven't we, that the importance of things like the community involved sector and resourcing that appropriately, which comes back to what we're trying to do through some of the funding that we've got to get the capacity there, because we can't make assumptions around that. And I think this gives us a chance and a platform to really do that through the conversations and say that actually if we do want to do this, it's got to be equality. So I guess it was just, I think it's just that this is the first opportunity, isn't it, to bring this for us. And I think I just want to re-emphasise that role for me is around how we knit all of these together. And I know, so my role as SRO in this, I'm sitting, that's with one of my hats on, which is the local authority hat on in it, to make sure that from a local authority perspective, we're linking, and I know it's particularly working, and Councillor Horton loves might want to come from an adult social care perspective. There's a real opportunity in this. We're completely embedded, but it isn't just adults for us. It's how we look through our ambitions around hubs and communities more broadly as a local authority. So we're doing some of that work to bring to it, because we're all looking at the same communities, and how do we bring our elements to it. So I guess I'm asking that from broader partners as well. Sorry, that was really long, but I'm very excited about this, and it feels like we're starting to move to its scale on some of this.
Thank you very much, Rachel, for your enthusiasm. I think at this point, I'd just like to emphasise that as well as all of this vitally important work, engagement of those people we're trying to reach is absolutely critical. And there are still parts of the community that we're not reaching. at this point, and we really need to reach out and find those people in our communities on a regular basis, so that people are not excluded. And additionally, just to emphasise that public transport is and other forms of transport are absolutely critical in delivery of some of these services in rural locations, but also in some of the urban ones. So, Ruth first.
Thank you, Chair, and thank you for the presentation. That's really interesting. You mentioned 5 neighbourhoods. So this is a bit of a hard question, really. Where are they? And what are the sort of plans as to how you will be linking with sort of local leaders and place shapers? And I'm not necessarily just talking about councillors. I mean, there are time and past councils, lots of voluntary organisations, and I don't think that quite came through in the presentation, but we really could have that sort of the how bit in some sort of comms plan that sort of it can be shared locally, and actually pick up on Bernie's point around how we identify those sort of more hard to reach groups as well.
I'll start with that. So the neighbourhoods have been defined, and this is a piece of work that was done collaboratively through Health and Wellbeing Board and SHIP. They've been defined around the primary care network geographies. So aligning our communities within those neighbourhoods. So we've got the southeast, southwest.
We've got half of the southwest in Shrewsbury.
So totally inaccessible. We've got North Shropshire. We've got Shrewsbury primary care network footprint, and then we've got the Shrewsbury, the Shropshire Rural Alliance. There are conversations currently happening about the ambitions of those people working within the southwest and that rural belt of neighbourhood together on a neighbourhood plan. So they are the 5 neighbourhoods that we have defined collectively as a partnership. In terms of the engagement and how we're working with them, Ali talked about the workshop we held last week. We've been working with these neighbourhoods for quite some time, but what we are currently doing is pulling together very definite action plans collaboratively with people and professionals who are working in those areas, but then working with the community and voluntary sector and our local partners to ensure that patient and people's voice is contributing to those plans, and they're informing the approaches that are being taken. So,
yeah, please. Okay. Well, thank you very much, Naomi. You recognise that we perhaps need to progress this aspect further in discussions. There were, of course, 18 neighbourhoods recognised by the Joint Strategic Needs Assessment, and these need to be looked at and incorporated into your structure. And I'm sure you're moving towards that. And so I've got Lynn first, and then Councillor Neil.
Thank you. Thanks for the presentation, and hopefully we'll get slides. But and I'm sorry, I've been off sick for a couple of weeks, but so I've missed things. But I'm really keen for Health Watch to be part of this. We're definitely going to be here for another year, so it'd be great to have a conversation about that. And I think for me, the thing is, it says we've got this for 12 months. Doesn't it? You said that at the beginning, and I suppose I worry that in our system, 12 months is like a day, really, because of how quickly things can work. So I've got a real concern about that, and what that means for the people working in this space, but also how you are able to show the public the impact of this piece of work. Because there's always these ideas and these initiatives. And if you speak to the people on the street, I think they would be really hard pushed to tell you what difference they've seen. So I think for any project like this, you've got to have a clear outcome. What do you want to see by the end of it? And how will the public know that this made a difference? Because it's a huge amount of work, a huge amount of investment. And, asking people to go along with potentially new ideas and change, but they've really got to be able to feel it, haven't they, and see the advantages that it will have for them.
Thank you, Lynn. And that partly relates to the effectiveness of communication about what is needed to be achieved, that's obviously part of the discussion that we're going to take forward. Leader, Councillor Kidd.
Just call me Heather.
Heather.
I am really concerned about the definition of these neighbourhoods, because the one I've seen takes a chunk out of South West and puts it with Oswestry, which we have no contact at all. We don't go there. Full stop. Nobody consulted me on any of that. So if the health hub for Oswestry is nothing really to do with us, and actually part of the South West, I do think there needs to be some consultation around that, because one of my GPs doesn't even understand why that has happened. So I'm really concerned about these things being imposed top down, and that's what it feels like to me as an ordinary, and I will always say it the way it is. And just because I'm leader of council doesn't make me any different than I've always been. So I'm really concerned about what you think is a neighbourhood and what we think is a neighbourhood, and what we did around the JSNA, which was around Bishop's Castle for all of us. But there are chunks of Shropshire that get left on the edge. And because it's inconvenient, they get forgotten about and shoved in with something. And it's not just my area. So I am concerned about bringing all this together, because it's a really good idea, but it does have to deliver for everybody, not just the bits that are convenient.
Thank you, Heather. I think it's clear that there needs to be further discussion on the definition of the neighbourhoods, and so I think that relevant parties will need to come together in the near future to work through this, certainly before Christmas. Rachel.
I think Nigel wants.
Yeah. Nigel.
So, if I may, so thank you for the comments. What I would say is that when we've got a number of really important and positive building blocks within Shropshire that have led to us getting a place on Wave 1, and that includes the work, as colleagues have said, about the Place Partnership Board, the work that Rachel and others have done in terms of the Joint Strategic Needs Assessment, really knowing our population, and then looking at building that neighbourhood approach. Just specifically, Heather, to the point, there was a lot of discussion about a year or so ago.
Not with me.
I recognise that, but with a range of different colleagues from the local authorities as well as NHS. So absolutely system-wide to all parts. I can guarantee that.
No.
If I may just finish, there is a point here, and Rachel alluded to it, on some of the terminology that we're talking about. Even if we talk about what was confusing from NHS circles, this came out as the National Neighbourhood Health Programme, and applications were actually for a place level. So we're ever so slightly conflating place and neighbourhood. The focus that we had from an NHS perspective over the last year, 18 months or so, has been really to look at how we weave in and engage with general practice. Hence why PCNs. So the general practice are split into the PCN boundaries. So groups of general practice in those primary care networks were an important aspect of this programme.
It's even more gobsmacking.
So I'm just trying to provide an explanation for how we got to
it doesn't explain it, because my PCN doesn't go that way.
Okay, but if I may, general practice, all of the PCN clinical directors are firmly part, and their teams are firmly part of this programme. Rachel and others, from a Shropshire Council perspective, have absolutely, and Naomi and others have absolutely kept firmly in conversations the 18 neighbourhoods that you have focused on, and that local focus that has. So I think we just need to be careful about getting hung up on terminology and look at the intentions of the programme that really are looking at how we deliver to that locality level. But it absolutely is a feature of trying to make sure that we've got all partners involved. And that's all NHS partners, including all primary care, including general practice, the local authorities, voluntary sector and residents. So I can absolutely assure you that that is absolutely the case.
Thank you, Nigel. I think that I don't want to prolong this discussion at this point.
I can't stay because it bears no resemblance to the way the geography works.
Heather, I think we've acknowledged that.
Really happy to follow this up.
Sorry, Nigel, through the chair, please.
Sorry, Chair. I'm really happy to follow up and have those further discussions. Really happy.
And so I would like to convene a meeting of the relevant parties to talk this through, to get to a solution that we're all comfortable with moving forward. And that's going to be before Christmas, because we need to get on with this programme and deliver what's needed for the people of Shropshire. But clearly, some elements of communication perhaps need some development. Thank you. Yeah, Claire Parker.
Thanks, Chair. Heather, just want to say, right at the beginning, sort of 18 months ago, when we agreed that we would initially use the PCN footprints, I was always really, really clear that that would potentially change, that we had to start somewhere. And we absolutely recognise the neighbourhoods as a locality. In fact, I am going to have a discussion in Bishop's Castle on Tuesday about what the neighbourhood delivery offer looks like from a health perspective for Bishop's Castle. So we are really conscious that we are doing that neighbourhood approach on a geographical basis. But I was really, really clear that we had to start somewhere. We'd start with the primary care network footprints, but that could potentially change based on joint strategic needs assessment, needs of population, geography and service delivery.
Thank you, Claire. And clearly there's a message in the room about communication and about agreeing on the precise definitions of our neighbourhoods. And so can we shorten the conversation on this particular item until we've had that follow-up meeting? And so, Richard.
I mean, I agree. I think we need to pick this up and be really clear so everybody can have their views and we can have the policy, because it's all about partnership working, isn't it? So we're really clear on the definitions. I just didn't want to lose within this the work that the benefits that this could bring. And I think there is, I absolutely understand the geography. We need to take everybody along with us and we need to recognise those flaws, because that's critical to all of this. And that this is built up. I think we started from, whilst we all had different definitions, and we're going to come into this with some of the other neighbourhood work in a minute of geographies, we need to get this as local as possible. That's the fundamental core of all of this. Whether that's practice level, an individual practice level to manage some of that, or
I have 4 practices. 2 PCSN.
Thank you. So I think unless there's any other items on this topic, Chris.
If I may,
this is a different area.
Same topic, but it's a terminology, a neighbourhood plan. I absolutely know why you use that because of the project and everything, but in local council world, that has a different connotation completely, a neighbourhood plan. Yeah. So we just need to be mindful that neighbourhood health plan would fit better rather than just neighbourhood plan, because of the sort of planning stuff and, you know.
I think, Ruth, that we've clearly identified there's a need for further discussion and the relevant parties will.
No, it's the title I'm concerned about.
That's part of it. So thank you for that. And so, please, if we can put forward that meeting, please, in the earliest opportunity. Thanks very much. And thank you. I think it's important that we have these open discussions rather than having potential problems or barriers to progress a little further down the line. And thank you, everybody, for that. And so we have noted the content of this briefing, and there's no more action there unless anybody else has got some other items that are relevant. Mo, as the police representative, do you want to say anything about the role of the police in trying to bring forward these neighbourhoods?
Yeah, I mean, obviously, wherever we can support around potentially those sort of harder to reach areas, any of the rural work, how we can support with our safer neighbourhood teams in particular, then obviously we'd welcome being involved there if we can be, and help, you know, reach those particularly more difficult areas with our local neighbourhood teams that we've got.
Thank you. And there may be some safeguarding elements and that need to be, we need to ensure are taken through this process.
Yeah, and obviously making sure, as you're aware, you know, that we've been working through sort of our vulnerability hub, which is getting back to where it needs to be. So certainly that will help, I think, support this position around making sure any of the contacts we have, those referrals are going through.
Thank you very much. Is there anybody else online who would like to say something, or should we call it to a halt? No, thank you very much, everyone. So we'll finish the discussion about the National Neighbourhoods Health Programme and move on to the Youth Transformation Pilot. So Helena, thank you very much. And Natasha.
Just finish a meeting. Is that okay? We're on? Okay. Hi everybody, I'm Helena Williams. I am the support team manager, sit within Early Help, and I've been working on the local youth transformation pilot. Next slide, please. Thank you, dear. So the purpose of this item really is to introduce the local youth transformation pilot to you all. Look how we connect youth work with public health and its prevention outcomes, because youth work uses public health approaches. Show how the pilot addresses health inequalities, particularly young people, and kind of outline what we need your help with, please. Okay. So why this matters? Since 2010, we have had a 98% reduction in youth funding and youth services, which has led to an incredibly fragmented system across the county of youth work. The system is currently, well, has been held by the voluntary and community sector, and they've done a fantastic job with that, but that has led to quite fragmented delivery. So we've got some really good offers of youth work within some localities where other areas don't have any at all. We know that 71% of 11 to 18-year-old young people say they don't leave the home in their leisure time. Recently, there's a report that's just come out by a national organisation called Onside that has reiterated that 79% of young people just use digital form as their leisure time now, but actually 59% of young people want that connection with people, but we have a disconnect between spaces and places in the community where young people can access, which has kind of driven young people into that kind of bedroom culture and kind of using digital media as a form of socialisation and communication. We also know the JSNA highlights that youth mental health and isolation as top concerns, but also kind of indicated that youth provision was a top concern for many localities as well. So you can see how it all kind of connects. And what we know is that our health of our youth ecosystem directly affects the health of our young people. So the local transformation pilot. So this pilot is a direct response to the kind of defunding of youth services over the country. So it's allowing us to help build that kind of system leadership back. There are 12 pathfinders across the country. I think there was about 48 local authorities that could apply for that. And we think that was in relation to a report by the YMCA, which kind of related back to that 98% reduction in funding. Shropshire is in the bottom 5% of local authorities spending on youth services across England and Wales. So it was a very, very, very quick turnaround as these DCMS funding streams are. So we put in an expression of interest to become a Pathfinder, and we found out in, I think it was July, that we were successful. So that was really exciting, really, to be part of a national pilot. We know that the learning from this programme will also inform the national youth strategy. That will be, I think, well, they keep pushing it back. We believe it's going to be come out in around January, February time. The focus on the transformation pilot is to rebuild that statutory youth offer and that workforce capacity. We have a bit of an issue with our workforce in Shropshire in terms of qualified youth workers from a locality level to a professional level. This allows us to look at that and put a plan in place about how we can build that capacity back. The delivery of this is between September, even though we didn't get the determination letter till October, so it's been quite a tight turnaround. So we're in the process of mobilising at the moment. There is sufficient funding that comes with this. 625,000 was allocated to the local authority, or actually 621. Most of that needs to be spent before March 2026. So we're covering 7 work streams. The first one is culture change. I think this is for me, this is the most important. I'm a team manager, but I'm probably the highest qualified youth worker within the local authority. And I think there's recognition that, this is around system leadership and understanding of that statutory duty. And I'll talk a bit more about statutory duty in a minute, but when the youth services was significantly reduced in 2010, 2011, we lost that system capacity, that system leadership in the whole of the system. And the culture change bit, it's integral that we build that back in, so you have that understanding. Because what's happened over the last few years is we've interpreted that statutory duty as the delivery of youth clubs, and it's not. It's about how the whole youth ecosystem works together, from that universal provision to that targeted provision to specialist provision for young people. It's all interconnected, and at the moment that's very fragmented and it doesn't work together as a system. So the culture change is a piece of work that will be done with the Local Government Association. They're going to come in and work with us, and they're really excited about that, and they're using this as a case study across the country, because this is the element that is going to create sustainability for this programme and that wider youth offer. The youth governance is a big section. Young people's participation is absolutely integral to youth work and to the system. They're always experts by experience because they're living in today's society. And it's very different to what they did 5-10 years ago. Things are constantly changing, and we need to kind of respond to the changes and those more complex environments that young people are now living in. So the youth governance work stream allows us to really look at what participation looks like across the whole of the system. We've got some fantastic bits of participation, but again, nothing connects, the system doesn't connect. So the youth governance section allows us to build that back in, and when we build the participation networks back in, that will allow co-production to take place. So what we're going to be doing in that section is we're going to be accelerating a hereby right national framework for participation. So that's going to give us a really good understanding about where we are in our participation across the system and help us build an action plan about what we can do to move that forward. The local youth partnerships, this is I suppose, I don't want to use the word evolve, it isn't evolving, it's about working in partnership more better with our town and parish councils, which we're really keen to do. We've already done an understanding the landscape sort of community profiling exercise with them to understand their views, and it's, it was really, really insightful, the report we have for that. We've also aligned that with the report that was done for the wider work with the town and parish councils. And it's quite evident that town and parish councils really want to work with us in partnership along with the voluntary and community sectors. So we know that the best way of delivering youth work down to communities is through partnership approaches. So we've got 6 youth partnerships that we're going to test out. I think we're going to test out 3. But the ambition is to go down to have 18 place plan. It's the only way to work. I'm a youth worker, locality youth working is the only way for me. So the ambition would be that we actually then move down to those localised place plan local partnerships. The infrastructure is the glue that holds it all together. So we are going to be working with a national organisation. They're also affiliated to this programme as well, the Young People's Partnership Foundation, and they're going to help us build an infrastructure that's fit for purpose for the youth sector today. And that's quite exciting. They are, I think they've got 61 youth partnerships across the country already. And I know all 12 of the transformation pilots are working with them to develop their partnership working as well. Workforce development, that is again about kind of building back that youth workforce. Just repurposing that little bit of work at the moment, just because we've got a better understanding of what things are like out in the workforce, out in the wider community with the BCS sector internally as well. We're also looking at reimagining targeted youth work in schools, knowing that adolescents need a different offer to family work. And so we'll be shaping that with our schools and our young people. And the last one is not really a work stream, but brought the resource to kind of manage this programme together. So it's a project management team that can work on this. So that's my biggest slide. Thank you. Next one. So statutory duty. So this is a statutory duty for youth work. It's section 507B of the Education Act. And it is around the improvement of young people's wellbeing. And I think over the last sort of 12 years, it's been diluted where I don't think there's been really any oversight of it. And it's probably, that's reflected in really what young people are experiencing in our communities. So this, again, is about building back that kind of knowledge and understanding and leading as a system. The local youth transformation pilot reframes this duty as a health and prevention duty. And the statutory duty will link to one youth offer and one youth offer plan. And the youth offer plan is the golden thread. That is about how we work with each other and our partnerships to make sure, and absolutely integral to that youth offer plan as young people, how we all work together to make sure that young people have what they need within their communities. Next one, Luke. So how does local youth transformation and youth offer tackle inequalities? It's geographic. We know in Shropshire, we know this from old, that sometimes in Shropshire we have to double, triple down on provision because of the rurality of our county. Many years ago, we used to have youth buses that we used to take out into those very small communities. If you've been around as long as me, you'll know that. And we used to, that was the way we delivered youth work into those communities. And also the voluntary community sector were really integral to that offer. So we know geography is one of our biggest inequalities. Socioeconomic, and also now the cost and opportunity barriers in deprived community. You know, I'd say our most deprived community in the whole of Shropshire has no youth offer at all. There's no spaces or places for young people to access. There's no activities or opportunities coming out of it. And those are the kind of things we really need to address. We know health and wellbeing, early intervention for mental health and isolation is one of the inequalities we address, and also the structural inequalities around youth voice representation of that young people in system leadership. Next one then. So what the new youth work structure will look like. So this is our internal team. Before we were just a detached only model, not sustainable coverage, and we weren't able to we had no workforce pipeline. We changed that a little bit. So the idea is that we as a local authority team, we're kind of the system connectors. We connect, and this links to kind of Natasha's Family First partnerships as well. So we're kind of more the system connectors. We're not the delivery of universal provision. That's where we want to work with our partners. So at the moment we have got 6 locality youth workers, and they've been identified at the moment through the areas of deprivation in Shropshire. We've got group work in schools and that prevention hub, contextual safeguarding and early health alignment, and professional development and career pathways. Next one. So Youth Voice, we're hoping to create a 3-tier model of Youth Voice. So we'll have the local youth partnerships that will have young people's voice attached to them, and they will shape decisions in their local areas. We will be creating an area youth assembly or something of that sort, where those local youth partnerships can feed into, and then we'll have the strategic youth partnerships. So what we're trying to do is build youth voice into every layer of governance,
So it's not moving up into the system, it's moving around the system. So I think what our ask today, please, would that you endorse youth work as a public health intervention. It would really be good if we could nominate a health representative for the Strategic Youth Partnership Board for that setup. We would really like you to participate in the culture change work stream. We're doing a separate session with members and with leadership, but then we'd like to go out to the kind of wider network and get them involved with that kind of culture change. And then we'd like to evaluate, align the local youth transformation evaluation with the JSNA prevention indicators as well. So those are our shared outcomes. I won't go through them. You'll see them on the board. And the next steps, I mean, that's just part, it's a really big programme to mobilise this is, and we're nearly there setting up the work streams now. Some of them are underway. Culture change one's underway already. Have dates in your diary for January coming very soon. The youth democracy workers should be recruited next week, I hope. And then we're working towards the co-produced youth offer plan, and that's. So in September 2023, that's when the guidance for the statutory duty was updated, and that's the bit we need to get to is the co-produced youth offer plan, and we're putting the infrastructure back in place so we can actually work with our partners to create that. And then there'll be a national evaluation for RSM and a national youth agency. But it's really good for Shropshire to be at the rural county, to be elevated into that national arena, and people hearing the rural voice. Quite often it's just kind of the urban areas, but to have Shropshire in there, and you know, I know the DCMS like our plan, they like our thinking, they know we're trying to strip back, and we're looking at structural issues, and we're addressing those before we start looking at direct provision, because this isn't around direct provision, this is about building that infrastructure back in place. And just a closing reflection, if the system can hold youth work will always hold young people, and that is prevention. Thank you.
Thank you very much, Anna, for that passionate presentation. And so this is a really exciting time for Shropshire. I just want to very briefly say that the issue of isolation comes through again, and that even with the best intentions, we can sometimes miss some of those who are most isolated in our communities, and we need to have a structured way of making sure that we at least engage all of those that need to be engaged, even if they don't take up the offers. And so thank you very much indeed. And so I'm going to open up to discussion now. And so Ruth, you were first.
Yes, thank you. And thank you for the presentation. I thought the first slide was a depressing start, something that's structurally dismantled. I don't very often make political points, but you know, it was. But where we are now is that there's the opportunity to build it up again and be positive, which is really pleasing to see as a portfolio holder for social care of children. I know Andy Hall online will be very pleased with this as well. So seeing that being built up is fabulous and really important, and to hear the voice of young people through all the governance structures, I think is really critical. I've got a couple of points though. Children with disabilities, how will they be included? Because very easy to isolate young people with a disability and not be inclusive. Is 620,000 sufficient? Probably not. If it isn't, how do we make it sustainable? The outcomes for individual young people, what are we likely to see? And a plea around the room really around whether partner contributions are in a position to access external grant funding to help support this service.
Thank you, Ruth.
So in terms of the SEND agenda, Ruth, it's a really good point, and I think what we're seeing nationally is that the direction of travel in terms of SEND is much more around integration. How do we make sure that children and young people are integrated into the systems and support so that actually we don't need something separate for SEND children? So I think there is absolutely a need for us to think and reflect upon the needs of all children, making sure that whatever we come up with is inclusive and builds upon that. And for some children, that bedroom culture will suit them because actually their needs are such that actually when they get into the big wide world, it can become sensorily overloading them. So I think there is a need for us to reflect upon that and make sure that whatever we come up with is appropriate. But I think that's why we need to make sure that young people are part of that process. So we've already been engaging with some of the representative organisations across the county to make sure that actually they've got an opportunity to shape and influence what this might need to look like. But I think it is important that we take the time to do that first, rather than jump into the solution. And, it'd be really easy to say tomorrow we're going to have a youth council or something equivalent, but actually we need to take the time to really understand what this needs to look like for young people. So that will absolutely be central to the work we're doing. There was a number of other points. Is the money enough? The money could always be more, couldn't it? But I think actually it's the first opportunity we've had like this for a long time. So actually we need to be grateful for what we have got and try and utilise it well. And that's why we're trying to do a lot of the work together. So Helena and I have been working really closely to make sure that the work we're doing in terms of local youth transformation is also attached to the work we're doing around Families First partnership, and also the work we're doing around family hubs and Best Start in Life, because actually, whilst individually those sums of money are very small, collectively they're all trying to do similar kinds of things, and it kind of links back to that conversation we were just having about the kind of health programme. Actually, these things are trying to do the same things. They're trying to pass back the voice to the community and use the community to influence what is a system that is ill-equipped right now to kind of respond to some of their local needs. So I think that approach is helping us. We've already identified several areas where actually we're both trying to do the same thing. So we're working together on making sure that we do that so that we can maximise the money that we have got. I think there was another point, Ruth, but I forgot it because I didn't write it down.
Outcomes for individuals. And I know you mentioned sort of mental health and social inclusion. So, but I'd like to see as the plan develops those outcomes collectively, but also for young individuals.
And I think that's a really important point, because as somebody who's worked in children's services for a long time and seen the needs of children almost deteriorate in some ways, and we've got more children needing mental health support now. When you look at the evidence base, what it tells you is children benefit from leisure activities and social connection, and that's what stops them feeling mentally unwell. And I think actually as a system we've kind of thought that CAMHS is the answer, and I'm sure if you went to a CAMHS nurse they'd say CAMHS isn't the answer. What the answer is making sure that children have got those opportunities to participate in leisure activities, which is exactly what your statutory duty is. So we will definitely be measuring those outcomes, because we think it's really important to evidence this has an impact.
Thank you very much, Natasha. And so we have Ben Hollands.
Yeah, thanks. I think Natasha's already picked up a number of those points I wanted to ask very eloquently, but essentially we're just moving into a recontracting of BU services, and there'll be a period of transformation in those services over the coming 3 years, and just want to make sure we're kind of making the connection around that shared agenda of essentially kind of earlier intervention and prevention, exactly as you say, Natasha. CAMHS and neurodevelopmental services are a bit of a barometer really of the success of how effective we are at that kind of prevention, early intervention agenda, but we'd be really keen to just make sure we're lining up those ducks, because there's a real determination in our services to try and look upstream, find earlier solutions for children, rather than kind of dealing with the problem as it manifests itself in poor mental health. So the offer's there. Essentially, I don't know whether those connections have been made with Gary Jones, who's the service manager for BU, but if they haven't, then I'd be really keen to kind of tee up that conversation.
Thank you very much, Ben. Do you want to come back briefly, Natasha?
I wonder, Ben, if we can pick up a conversation outside of the meeting just to try and think about the connection with that culture change piece, and also making sure that we connect those people to the strategic representation that we're asking for.
Made a lot of sense.
Thank you very much. And so it's clear that in increasing the leisure and other provisions for young people is likely to have a very substantial effect on the need for children's mental health services and those people in adolescence and the young people. So I have Heather next.
It is really a good opportunity because youth services across the county, and I do remember the youth policy. I've been here far too long. Actually 38 years. So I do remember all of this. And interestingly, if you're looking at deprivation of that, where you're putting these main services, that will be mainly in the bigger towns. We're really poor at actually looking at deprivation out in the countryside. So I'm interested in, firstly, outreach and whether you're looking at outreach to those areas. And also how we're going to build in sustainability, because when this money runs out, it's run out. So to create something just for it to die is a really, really big problem. So one, it needs to be a success, and two, we have to lobby government hugely to put more money back in, because as you know, Shropshire Council has absolutely no money, and the Improvement Board will not come up with any more. So it's a difficult position, but something that's really worth working on. And it needs to be really high profile, and it does need to make all those connections with everybody else, whether it's the police or health or whatever, across the board. So I think there are bigger conversations to have around that, certainly within the council. I'm also interested in making sure that social prescribing actually works for children as well, young people, because it works for adults, but not necessarily around young people. And that may be access to our leisure centres and all the rest of it as well. And who was it? Tanya asked for a national trust for carers with or young people who are in care, whether they could have free access to some of the big sites which are very children orientated now, young people orientated, and they said yes. So there are lots of links that we need to put in place around this to get young people out and about and not just sitting isolated in their bedrooms on phones. I have 4 grandchildren living with me at the moment who are beside themselves because the oldest one is not allowed to have a phone. But it's a huge area, but it has to work, and we have to get follow-up funding, otherwise it will die.
Thank you, Heather. So very brief, Natasha.
Okay, so in terms of sustainability, what I'd say is that the bid was really smart in terms of the way it was written, in that what it did was gave us a year of infrastructure to build something that's sustainable for the future. So actually this is about saying, let's get that youth voice participation all throughout the system. Let's get that infrastructure organisation set up and the community mobilised, and then actually the small bit we have got, we can continue to do working with that kind of infrastructure. So I think the sustainability I'm less worried about because of the fact that the bid was written in that context. There was no more kind of cash. I totally agree around the lobbying strand, and I certainly think there's something we can and should be doing, and perhaps that's a conversation we need to pick up with LGA when they're here in the new year. And in terms of that local outreach, again, I think because we're working so closely together, we're really trying to make sure that the work we're doing on the needs and harm assessment as part of Families First Partnership is thinking about the needs of local young people. And again, that needs to be built into our thinking around that model. So again, it's not necessarily one or the other, it's about how can we work effectively together to define actually what is the resource we need within that community that meets the needs of that group of children. And if actually that is more youth provision, that's something we should be building in and not more social workers. So it's about getting that balance right for the local population.
Thank you very much, Sarah. And of course, the place of the voluntary sector is absolutely critical in this area, and we should be enabling as much as we can those resources in the community that produce fantastic value for money as much as we can. David.
Thank you, Chair. So just building on a couple of those points, I think absolutely the voluntary community sector, but I think there's also a role for town and parish councils. And we know certainly for the direct delivery aspects of youth provision, we know already that a number of councils across Shropshire do this really, really well, really successfully. So part of the work that I and the team are doing is taking those great examples, sharing those more widely, and seeing if we can build a scheme around other town and parish councils collectively across Shropshire to expand that and develop that. And I think that references Heather's point around sustainability, because this isn't just for Shropshire Council to do this work, this is for the community. And I think it's like you say, there's some work around language, neighbourhoods, communities, etc. But ultimately it's around getting those conversations happening at that level. So I'm encouraged that we're aligning all of those things together. And I think there's definitely an ask strategically for this group, this committee, to align with that work. And I know, colleagues, you're working with SALC and other groups that are in this space as well. So it's just worth putting that on record, Chair.
Yeah, thank you very much, David, and I wholeheartedly agree and support that. The one slight caveat I would have is that some parish councils are very small in number and may not have the capacity to take this on by themselves, but by forming groups or forming partnership with some of the other larger parish or town councils, then we may be able to take things forward in an integrated way, such that the smaller parish councils don't feel it's too onerous. I think Rachel was going to come back on social prescribers.
Just very briefly, I think that, so just in terms of social prescribing, absolutely agree. We do have social prescribers for children and young people, but with very, very small numbers. We've struggled to fund it. We brought that through to this board, and others we have through some of the prevention money through SHIP, being able to put some of the funding towards that. That was agreed collectively because we knew it was a gap. There is an extra 100,000 going into that this year, but it isn't enough. And I think we all recognise the value of that and so agree. It's one of those things we need to keep lobbying for, but equally not duplicate. It's about aligning. We've got that resource, so we're bringing it together. So I think the other bit for me was, Natasha, you said it very well. This is about, we are all trying to achieve the same aims, whether it be for children, young people, whether it be for adults, for our populations. For me, all of these, it is that alignment, that strategic alignment of these programmes to make it make sense for us. So and I think there's the threads in there around culture we've been talking about. We're all talking about that partnership working, and it will only be sustainable. I think back to your point, it will only be sustainable if we align these, because that's actually when you get the maximum use of your resource, and we're not duplicating. And we can't afford to do that because we haven't got the resource to do it. So I think that's the bit that I keep asking that we align this to come through.
Thank you very much, Rachel. Is there anybody else who wants to say anything here? I would just like to personally thank the police for locally supporting the youth effort, and certainly from my personal experience in Shrewsbury, they've been extremely supportive and engaged, and I anticipate that Shropshire Police will do the same. That is, the Shropshire branches of West Mercia Police will do the same as the offers roll out across the county. Have you any comments, no?
Yeah, exactly. I mean, I think with the anything to do with the youth provision, certainly we want to support, and that engagement work, particularly again with our local neighbourhood teams and our PCSOs on the ground, that engagement is key. And I think that we've seen, but I've seen the worst case of some of the isolation and what that can lead to, unfortunately, and unfortunately what can be accessed online. There's certainly anything we can do to support there and reduce that. It looks really, really positive. So anything we can do to support, we'll be there with that one.
Thank you very much. And so the Health and Wellbeing Board is asked to endorse youth work as a preventative intervention, contributing to the healthy people priority, to nominate a health representative to join the strategic youth partnership, to align local youth transformation pilot evaluation metrics with the joint strategic needs assessment and prevention indicators, including mental health resilience and participation, to support shared investment and data models between public health, early health and the Youth Partnership Foundation, to utilise new channels for engagements to develop work aimed at young people and champion youth voice through Health and Wellbeing Board governance structures, and 6, that the Health and Wellbeing Board formally participates in the culture change and leadership work stream of the local youth transformation pilot, embedding the youth work as a shared prevention responsibility across the health and care system. I would just like to add a small rider to that training of ongoing support in this area is going to be critical, particularly when this current level of funding runs out. So, members of the board, I'll propose this motion. Can I have a seconder? Thank you, Rachel. Those in favour? Any against? Any abstentions? Thank you. So that's unanimous. Thank you very much indeed, and thank you, Helena and Natasha, for an exciting presentation. Thank you.
Excuse me, Chair. Is there any heating in here? Because
it's really cold.
Let's go in us.
Thank you. Multiple rows.
Do you want to? I've got a bench, Kate.
So
It is on.
So we could jump up and down on the spot for a few minutes, but we're moving.
No, we can't.
So can we move on, please, to the Place Universal offer? Pete is our Chief Executive Officer at Energise Shropshire, Telford and Wrekin. Thank you, Pete.
Sort of jumping up and down on the spot's a nice segue for an organisation. Some fair for that info. Louis, bring up the slides.
I'm doing my best, so just having a bit of a moment before we go.
I thought essentially I'm here to present an opportunity, an investment opportunity that aligns with everything that we've heard from the previous two presentations. So hopefully when we talk about strategic alignment and collaboration, there's evidence here that we're getting our act together, and we're demonstrating that through this opportunity. Yeah. If we could go on to the second slide, please, Lou. I thought it'd be worth, just for maybe a relatively new audience, just to explain. Energise are the active partnership for Shropshire, Telford and Wrekin. We're one of 43 active partnerships across the country that are funded through Sport England. Sport England effectively act like an arm's length organisation for the Department of Culture, Media and Sport. And our remit, bottom line, is to use movement, physical activity and sport to tackle inequalities. So historically, active partnerships may have had a directive which was around sport for sport's sake, but more recently, through government reform and government policy, Sport England have encouraged the active partnerships to address that broader what is the role that they can play in terms of movement, tackling broader societal and community issues and tackling those inequalities. Hence why we have a strong health focus now, rather than just what you might have perceived traditionally being sports development. Interestingly, with Ben on the call, me and Ben were in a sports development team about 20 years ago, but I digress. Could I have the next slide, please? This will be familiar to you as well. Just about the positive impact of being active. I think the audience is pretty well clued up on this, so we perhaps can skip on to the next slide.
It's a little bit of a lag, sorry about that.
Okay. So, as I said, we are funded through Sport England, and we get a 5-year investment to a predominantly, it's framed system partner. So it's about how do we use physical activity and movement to influence system change and address all those issues that have come up in conversation over the last hour or so. Recently, Sport England have adopted an approach called PLACE, where they've looked at trying to connect the dots, for want of a better phrase, connecting systems in a locality to try and influence system change and provide more effective, efficient systems that improve health outcomes, increase active lifestyles and healthier populations. Over a 10-year period, those pilot areas presented some really successful data and insight. And as a consequence of it, Sport England have realigned some of their investment strands to distribute out to all 43 active partnerships And I'm here to say that Shropshire Council, as a local authority area, has been identified as one of those areas for that additional investment. It's called Place Universal Offer. And if we go on to the next slide, that investment is worth £510,000 over 2 and a bit years, from January 2026 to March 2028. So if I go back a step, when we knew this opportunity was going to land, we approached Rachel, Naomi, Anne-Marie, just to get their thoughts on how we approach this systemically, and not just necessarily through the lens of public health, but how we bring other departments in to have that cross collaboration. So as the slide is showing, the planning process for the use and the how we were going to use this investment was decided through a collaborative cross-directorate departmental approach. We also involved health sector representation and voluntary sector representation. And just so everyone in the room is aware, there was Sport England representation in the room, because obviously there are certain criteria that we have to meet from the Sport England perspective. To ensure that there was the relevant mandate and governance processes in place, I did approach Rachel to see if the SHIP would act as that scrutiny panel and ensure that the appropriate governance was in place. We took a paper to SHIP and that was formally approved. So even though there are working groups and planning groups, in terms of the elevation for decision making and final sign off, that comes formally through the SHIP board. If we can go on to the next slide. So before we go into a bit of the detail, I think this was the emphasis from Sport England, was about doing things differently and just understanding how far individuals are away from policy decisions, and how do we try and join that up. And we've heard a lot about neighbourhood working, haven't we, hearing from the individuals' lived experiences already within this room. And those are some of the principles around this Place Universal Offer investment, is about being closer to those who are in the greatest need, but equally trying to influence that policy and those systems to benefit those who are in the greatest need as well. So it's more of a joined up approach. And this has been shared with me, and I believe it's an onion diagram, if some of you weren't familiar with that. But basically, it's just trying to say how, through a test and learn approach, and from more transformational work, moving away from transactional work, can we bring the individual closer to some of those policy decisions, and vice versa. So next slide, please. This is the meaningful bit. So after a few months of discussions, and I have got an old school paper copy if people are interested in that. This was the type of areas that we identified some of the investment could go towards. And what I want to put on as a caveat, some of this is still quite agile. We had to get a high level paper at Sport England to outline what the submission would look like, what the investment would look like. The investment is ring fence for Shropshire, so we are never not going to get the money, but there was just 1 or 2 conversations needed to be had to ensure that Sport England were happy with the direction of travel. I think I need to be really explicit in saying that we wanted to be led by those things that were going on already. So the NN HIP and the local youth transformation pilot were key for that. So in terms of some of the place-based test and learn approaches, some of the activation of tools and resources supporting stuff that's already taking place, we very much wanted to be led by stuff that was already going on and not recreate stuff, just add this investment onto what was already taking place. I think how I've landed it previously with SHIP and the working groups is this is an opportunity to maybe do stuff that your current budgets and your current structures do not allow you to do, but let's learn from those approaches and maybe take some of those learning into strategic decisions and policy decisions potentially in the future. Within this does also come some capacity and capacity building. We've been working specifically with public health teams with Helena, with adult social care. And interestingly, we've had some engagement with the planning team because we believe that decisions made within the planning department also can positively impact on increasing the opportunity for movement and physical activity. So as well as having the opportunity to do some stuff and test and learn some stuff, this is also an investment opportunity to try and see how we connect those departments and some of the decisions that are made cross-departmentally. And I appreciate and I gather that's how you want to operate as well anyway. So we're not necessarily trying to recreate anything here. And again, just reinforcing that message, Energize are very much the gatekeeper here of the funding, but the devil in the detail is a collaborative approach and comes from existing projects and programmes that the council are driving and those other partners involved in the project. So you can take time to read the sheet that's in front of you. It's quite high level still at this stage, but that was for the purposes of getting the initial submission over the line. So if we can come to the final slide, which is just to say we're at the back end of the assessment and decision-making window, and we hope to get notification of the grant award within the next few days, with a project start date of January 2026. Now, a couple of points have been raised already regarding other presentations, so maybe I can address those. From a sustainability point of view, the idea of place and targeted work, I think, will be a constant for future Sport England funding. So 2027 is a end point for what we call system partner funding. 2028 will be the end point for place investment. I think Sport England are going to align those two investment strands and very much have a place focus. So I'm pretty confident that there will be an extension of some of this money from 2028 onwards because there's a real narrative around place work. What we would also, and hopefully this is the thoughts of people in the organisation as well, or in this board, is that some of the system changes, some of the system leadership work that we will be doing might influence policy and decision making internally anyway. So even if you've got the same level of funding, whatever that might look like in the future, maybe we're making more effective decisions around that funding. So that was some of the principles behind this particular project. So yes, fundamentally, it's about increasing movement, making people healthier, and that will be measured through the Active Lives survey, of which actually Shropshire are on the up. However, if you unpick some of that information, you can see that it's basically because those who can access sport and physical activity do. So for want of a fear of being too cliche, predominantly middle classes are able to access it. But where those who face the greatest inequalities still aren't accessing movement, physical activity and sport. So we've still got, even though the figures are encouraging, we've still got issues to address once you start to unpick some of that data. That's me, Pierre.
Thank you very much, Pete. I've just received a message that there's a problem with the boiler in the building.
The problem was with the other
facilities apologise.
I'm sorry, Chair. I don't think this investment will allow.
It is warming up since I've turned the other two radiators on.
Right. Thank you. And so this is very welcome, this funding, and as with some of the other presentations today, the engagement of those who are isolated, those who don't normally participate in these activities is really important. It's well recognised that increased exercise increases general well-being, but also both physical and mental health. And so we should very much welcome this, and thank you very much, Pete. Is there anybody wants to have a discussion on this? No. Well, I would like to say from the chair that I would challenge the members of the Health and Wellbeing Board
to consider a particular form of physical exercise that they will either continue or develop, but in either case will then communicate to me, the chair. And I've already agreed that I will do another 75-kilometre bike ride next year for Age UK, and but also to promote health and well-being in the community. So I would like you all, please, to identify particular physical activities that you're either going to start or continue, and to publicise. And if you want to raise money for good causes, then I think maintaining the sports facilities and the ability for otherwise disadvantaged people to participate in sport is a very worthy cause to have. Thank you. And so this paper was for noting, and we don't need to vote on it. So can we move on then to winter wellness cost of living support, the VCSE support from Jackie Jeffrey, Chief Officer of Citizens Advice, Shropshire, and Fran Romberg, VCS Engagement Officer, Shropshire Council. Thank you.
Hi, apologies first. I don't have a presentation, and whoever wrote the covering report, thank you very much. I didn't have time to do any preparation for this, so whoever did the report and whoever was asking for the report and I didn't do it, I apologise for the frustration. I guess I'm a really good case study at the minute about the state of some of the voluntary sector, and as a voluntary sector organisation, about how struggling with a number of internal pressures. And to quote my wonderful colleague Heather from Age UK, feels very much a bit like a triangle of fire, with increased demand, reduced volunteering and reduced resources all round. I've had to kind of look internally for a while on my organisation. So that's why I really want to push the VCSA, not just the voluntary sector, but the Voluntary Community Sector Assembly, because we come into our best then, because when I can't do something, if I'm representing something, I know I've got a colleague that comes and can represent. And Pete stood in for me before on the ICB. When we talk about partnership working, the neighbourhood working, the work with youth, what we're doing is please use the Voluntary Community Sector Assembly. Not just working with the voluntary sector isn't just about working with one voluntary sector organisation. It is work with the Assembly. A wonderful Fran, who's a Shropshire Council officer who coordinates all this work. Fran does the newsletter. She supports the Voluntary Sector Assembly board meetings and the 15, 16 forums of interest. We are a power of force, and we support each other, and it means if one voluntary sector organisation can't do something, somebody else will step in. We can communicate down the system, we can bring up in the system as well. So when we talk about the neighbourhoods, when you talk about voluntary sector, please use the Assembly, please use our, and I know Bev went on the, and Pete have been that, so kind of just saying that because I just apologise for my, as I go through this, the fact that I haven't been able to do as much within the cost of living and as I normally would have done. So, and I did my notes last night, and it's great that whoever did the report, and I hope it was Fran, reflects their notes as well. So just kind of starting about the voluntary sector and what we're doing for winter support. Sounds grand that we're all kind of collected and have done a coordination. Not at all. This is a bit about what we're doing in response, or what's available, supporting people through a really pressured time on the cost of living and keeping warm as well. And you know, go back to the days of the social task force where we did so much together with no money, and we just made sure that we knew what was going on, and we can plug the gaps. And but yeah, so community-based support and warm spaces. So voluntary sector organisations are going to be offering special Christmas events to combat loneliness over the winter. organisations taking part in the warm spaces scheme as well, offering buildings as warm places for people to be for free, and providing activities as well. For children and young people receiving free school meals, they can find support through the Holiday and Activities Fund, and lots of voluntary sector organisations are part of that. Household and financial support. So here again, another apology. Food banks will be operating and usually are very busy over the winter period. Please be aware of the referral schemes to the food banks in your local area and go to the Shropshire Larder for that information. There's a full list there of food banks and community food banks. I lead the Shropshire Food Poverty Alliance, and the Shropshire Larder and the Shropshire Food Poverty website has all the information. I used to have a team of three that supported our policy work and the Food Poverty Alliance. I don't have anybody at the minute, and we're recruiting to one post, which we are funding to the end of March. But after the end of March, it's our voluntary, my charity reserves that will be funding this. It's really important, that strategic thing around hardship and poverty, and kind of supporting the food banks who aren't supported by the Trussell Trust. It's 15 food banks in Shropshire, only 4 are Trussell Trust supported to have infrastructure support. So we've been providing that infrastructure support. So I really don't have any up-to-date details of what's happening with the other food banks, apart from where I've got community advisors sitting there supporting people. But yeah, food banks are really busy at the minute. They're over increased demand, and the demographics of that are changing as well. We've got a lot of working families accessing food banks as well. And alongside the kind of support that's coming through the Hardship and Support Fund, which is what the Shropshire Council manage, and it's money down from government. We're really proud of the way that we've worked as a sector to set the principles of how that money is going to be spent. This last year, it's gone to community resource, supporting people that struggle with heating bills that aren't on grid, so logs, oil, coal for heating. We've got March's Energy Agency and Keep Shropshire Warm. There's resources in there, there's support there for helping people with utility bills, and as well as free school meals going into the summer, over Christmas and into Easter. So there'll be changes there coming anyway as well. We've Mills provides goods for people on low income as well. So really our partners are just doing a magnificent. Shropshire Council as well are helping people with council tax bills where they're on low income and working age, where they have to pay 20% contribution, whatever their income is. So the council have supported people on low income of working age there as well. Health and Wellbeing, so this is in the report, community transport offers as well, and Age UK can support people, older people shopping and befriending. Can I just say these are all services that we offer all year round. This isn't just coordinated for the winter, but what winter will mean is that we'll be overstretched and increasing demand as well. And Fran's gone out to the Shropshire Mental Health Forum, the VCSA Mental Health Forum, to find out what's happening over the winter with people supporting people with mental health. So we'll put that out when we've got that information. So yeah, please look at the VSA newsletter for any updates on that. Please work with the Voluntary Sector Assembly if you need any information on partnerships as well. And can I just say that the Rural Winter Wellbeing Project, which is a Shropshire Council kind of neighbourhood, we didn't really know about it as a sector that we could be part of. It would have been great if we'd had that neighbourhood funding that went through the SHIP available beforehand, so we could have been part of that, going out into rural communities, helping people with wellbeing and the cost of living. We haven't been able to be part of that, and it would be great next year when that happens that we could do that. So a lot of apologies from me. Please look at the Assembly newsletter for any updates, and we'll make sure we'll make sure that that goes in. There's a lot going on, just a bit uncoordinated at the minute because of lack of resource. So I hope that's okay. And whoever did the report.
Thank you very much, Jackie, and of course the voluntary community sector is an absolutely critical part of services provided to people in Shropshire, and the more we can promote coordination and the work that's done, the better.
Fran's really important. We had a massive infrastructure team within the council. I appreciate we're under pressure, but where you make choices, Fran's a critical role within that structure. And I was talking to an elected member a few weeks ago when they were saying that the voluntary sector is really important because we're going to need volunteers to do things for free that we can't afford to provide as a council. And I can only say volunteers are not free. Voluntary sector is not just about volunteering. We're in business, but our profit is about community outcomes and wellbeing. And volunteers need support. Charities need support. We can't plug the gap for free.
Thank you. That's a message well taken. Thanks very much, Jackie. And so, any comments from any of the members? Rachel.
Yeah, I mean, firstly, absolutely recognise, and I think we've said throughout the role of the voluntary community sector and the assembly is so fundamental, and the capacity issues you said is we recognise collectively, haven't we, that it's been a challenge. So I think that funding is going to be really important. But then again, it's sustainability of that funding. We can't forget that even once it's resolved. I think the other thing was to flag in this was, you know, when we talked about, when we had the health, when we talked about neighbourhoods, when we talked about the youth work, we've been talking about the causes of the cause and the support, and this is why this is so fundamental. Many of those people who will end up in crisis are needing support. If you talk about your frail, we've talked about the frail, we know at winter that we see some of that escalate, and that's one of the reasons it was so important to highlight this. And in terms of the support that's available for people early, for people who live in those cold damp houses, our young people, again, in the support, and it just shows how all of that works together, whether that be the Housing Support Fund to get to the right families. So I think the trick of us all is making sure that we do get it to the right places. So I think that was one of the reasons I just wanted to highlight why it was really important that everything does fit together, and that support is part of that bigger offer that we're developing around our services.
Thank you very much, Rachel. And I'd just like to say that the VCSA AGM is next week on Thursday, the 27th of November. I should be going to that, and I hope that other members will consider going as well. Because this is a really important forum for bringing the very wide range of structures together with the voluntary groups. And so I'll be looking forward to that. Thank you very much, Jane. So we move on to the Better Care Fund 25-26 quarter 2 template. So Jackie Robinson, I think, will make a presentation.
Thank you, Chair. I can't see people's faces, so I'm assuming the camera's off in the room. The papers that were circulated in advance were actually circulated to yourself as Chair and Simon Whitehouse for submission. We have to comply with the national timeline, which was the 11th of November. So all the papers have been read through and checked over. The template was approved, as I said, by yourselves, and we're coming to the board now just really for a retrospective approval. What we can confirm is that quarter 2 performance data is showing that Shropshire is back on track to achieve its metric and plans for emergency admissions, delayed discharges and residential admissions, which is really positive, good news. As a BCF, we will be asked to develop a 1-year BCF plan for 26-27, and after which the BCF planning will become part of that neighbourhood health planning. What we can't confirm is what that guidance is, yes, what shape or form it's going to take. What we can confirm is that we're ready for it.
Thank you very much, Jackie. And so, are there any comments? Anybody have got any questions?
If I may, Chair, I'm just that's really good news that the metrics are on track again. I am concerned about the winter and the potential for spikes. Jackie, and that to distort that positive progress. I'm just wondering what's going to be underpinning that, given that there's limited funding through winter pressures.
Well, there is a winter plan that's in place, which is informed through local authorities, trusts, and the ICB colleagues don't have that to hand. And clearly they started it earlier this year, which was good. And I think that's sometimes been one of the kind of stumbling blocks, that things have happened a little bit longer into the year, and it's become more of an issue. Whereas this year it started a lot earlier, and they feel more confident and more in control of the circumstances as they arise. But as you well know, things can spike, and we have to stand up and deal with that as it happens. But I completely take your point.
Thank you very much. The winter plan is coming up later in the agenda. So, are there any other questions about the Better Care Fund? No. Okay, thank you. So the board is asked to approve the Better Care Fund 25-26 Q2 template, which is in the papers in Appendix A. So I'll propose. Can I have a seconder? Thank you, Rachel. And so those in favour on the board? Any against? And any abstentions? So that's unanimous. Thank you.
Thank you, Chair.
Thanks very much, Jackie. And it's very reassuring to hear things are on track
yes.
in such difficult circumstances.
It is having some good news at such a time of change is a really welcome relief, isn't it? Thank you, Chair.
Thanks very much, Jackie.
Bye-bye all.
All right. So we move on then to health protection update on vaccinations. Rachel Dulson, Executive Director at Public Health and Shropshire Council.
Thank you, Chair. So we're obviously report to the standard report that we bring around for assurance looking at health protection issues. We wanted particularly this report to just focus on where they are with immunisations and vaccinations. There's information in the report that reminds people of their eligibility. I just want to highlight that particularly because I am aware that there was some confusion this flu and COVID season because of the changing criteria around COVID method. Some members of the public were confused about whether they were still eligible for the flu vaccine. So particularly our older population, our over 65s, because with COVID it's over 75s, and there was some confusion around that, and therefore that has impacted on some of our uptake. So just wanted to remind people that that is available, particularly the flu vaccination. There's figures in the report, but we do get weekly updates, and I'm pleased to say that in terms of vaccinations, our rates are also increasing. We are nearly back to the levels that we were at last year, and we are approaching achieving some of our ambitions around immunisation and flu uptake. Having said that, over 65 for flu is down, so we obviously want to encourage people to get their vaccinations. And there's still more work to do, and more. You'll see some more social media coming out, which we want to cascade around 2 to 3 year olds particularly. I think we have seen an increase in our healthcare workers uptake. Again, rates are increasing, but I suppose with all of this, as you'd expect, as we come towards winter, the message is always to everybody: having your immunisations, vaccinations is something simple you can do to help protect you and your loved ones this winter. So it's about promoting that message, some of those prevention messages. We'll keep the board updated, but rates are increasing, but there's more we can do. And there is more social media coming out, and I know the teams are working to cascade that so it can get to members, it can get to officers, and get that out through as many channels as possible.
Thanks very much, Rachel. I'd just like to endorse the message to all to become vaccinated, to get yourself vaccinated if you're eligible, and it's not just yourselves, it is our loved ones, our neighbours, the frail and the elderly, and so there is a community aspect to this, and additionally, of course, the more people who are vaccinated against respiratory illnesses, the fewer will come to the accident and emergency departments of our hard-pressed healthcare services. So thanks very much, Rachel. And so are there any questions or comments?
Sorry, we've just been looking at the the school-age children for vaccination rates of 9.4 for primary and 7.9 for secondary. Are there any actual action plans around that, Rachel?
Just I should have said that, sorry. The school age data, it's been an issue pulling some of the data through. So there is a rolling programme of going to all of the schools, and then there's catch-up clinics around where people haven't been vaccinated through the schools, and there has been an issue pulling through some of the data. So that's why the numbers look
probably higher than
they are high. Sorry, apologies. Well, that's our understanding. So there's work in the background to understand. For a while we were at zero, even though many schools have been started. So they have spoken to the trust and it's a ShopCon bring that programme out, and that programme does continue. But there is mop-up that will go on. The other thing that we have got, and apologies that hasn't started yet, is we do outreach as well, and that's just being worked through to agree those locations and the vaccinators that are needed to do that. So we do a further, the bulk of it's done at the start of the season, if the flu season, if you like, through pharmacies, through GP practice, through schools, and then there's a kind of mop up after that. But I'll get the most recent figures, which have increased, but there's still a data issue there.
Thank you.
Thank you very much, Rachel. David?
No, it was just building on this point. To be honest, I think the more proactive we can be. I know there's some reactive sessions that are taking place now. I know there's a session coming this weekend actually at some of the secondary schools. I think the more we can do, the better, really. If there is anything that we can do to support that, we'd absolutely want to do as much as we can. And I think similarly, Chair, governors as well. So any members who are governors, any members of the board who are governors or know anyone, we could just use that as an influence to encourage. This time of year is notoriously busy in schools, primary and secondary. So if there's anything we can do just to make that a priority as well, that would be really appreciated.
Thanks very much. And Rachel, I wonder if you could say whether there are any items on capacity we need to consider, or is capacity in terms of the vaccination programme, the delivery of vaccines, where it should be?
I think so. There is a rolling programme. I think you've been made aware that there might be this time of year you always get staff sickness, and therefore you'll get numbers of individuals who might not be able to attend, and therefore numbers are reduced. So I am picking that up. That has been flagged to me, but this obviously through the year as it's gone out to some of the schools. And remember, immunisation of vaccinations is very complex. It's provided by a number of partners, and it's often multiple partners providing some of this. So that is something I'm following. So I think one of the schools that's been flagged that there was less vaccinators at that point. So there'll need to be a revisit there to make sure we capture everyone. Obviously that leads to a time delay. So I will pick that up with the services. But I know there will be mock-ups there where people make sure people can be.
Thank you very much, Ricky. And those in the healthcare provider sector, Natasha, have you any thoughts about what is more successful this year than it was last year? Because I think that the vaccination rates are up, and we would hope to get to a very high level. I'm not sure that any of us will get to the West Midlands ambulance service levels of over 90% vaccination of all of their staff, but clearly that's a benchmark we can look at.
Thanks, Chair. Yeah, so I think certainly from a SATH perspective, the chief nurse is actively leading, and she herself is a peer vaccinator. So I think executive leadership and senior visibility has played a key role. It's been publicised widely, as well as just making, as we know, and as Rachel's alluded to, trying to make it both accessible and to fit in with shifts, depending on whether they're clinical or non-clinical. But we're already well ahead of last year at this point, but we know there's plenty more to do. So continued active visibility and communication.
Thank you very much, Nigel. And I think we decided that once this season is over, this particular respiratory virus season is over, we'll have a look at an early stage, perhaps in the spring, to determine what things we can improve on to get as many people vaccinated as possible who are eligible, to try to help overall community health, but also to reduce presentations to the A&E department and the filling of the hospitals with people ill with respiratory illness. Thank you. Any other questions or comments?
I was sorry. I was just going to ask regarding that, maybe a random question. If we have all these flu vaccinations and they're not taken up, is there any point at which they become available to the people who aren't eligible? Do you know what I mean? Rather than going to waste, I don't know how flu vaccinations work. Is there a system in place for that?
I think I'll have to speak to colleagues in regards to that. There's specific rules, I think, around who you can sort of trying to think of the terminology you might know around who you can prescribe to. So it's a particular organisation that's obviously some are made available to pharmacies. Anybody can go and obviously buy your own vaccine. But within specific organisations, there's usually a pathway around who you can deliver that vaccination to. I think this was something we did look at and say, could we do that more broadly? So, for example, even I think it was to your particular organisation, and if social workers were there at the time, could they then be offered it? But there was very specific prescribing pathways for those individuals. I can certainly follow. It was something that we've talked about with NHS England, and they said they would look at more broadly, particularly for next year, because we'd raised the challenge around healthcare workers and social workers, for example. So I'd have to. It might depend on the setting, I suppose, is what I'd probably say. Not very clear way on what the arrangement was in terms of that prescribing. It's a lot of planning goes into numbers in terms of numbers of vaccines, and then. Agree with that, but I'm happy to say that we have raised some questions.
I guess then you were referring to situations where vaccine might otherwise go out of date if it wasn't given, and the mechanism for trying to prevent that happening. And
it just seemed like a lot of potential for waste when people who would normally have to pay might be able to access something that they actually want. So yeah. That's my question, really.
Yes, we'll consider that and make the necessary inquiries. Thank you. And so, if there are no other queries, then this is a recommendation that the board is asked to take the opportunity to comment on the vaccination project plan, which we have, and for all partners to promote vaccinations, to maximise uptake of seasonal vaccinations, and for all partners to share communication resources. So I guess that's in relation to the uptake of vaccinations. So thanks very much, Rachel.
Just to put my comment into some context, I've just had 2 weeks off with the most horrendous flu. And I had the flu jab the day my flu started because I was a carer, but I'm no longer a carer. So next year I won't be eligible for it. But I must tell you that the flu that is happening at the moment is very frightening, and it makes you very, very unwell. And at one point I thought I was going to die. So if anyone needs the flu jab, get the flu jab.
Thank you very much, Lynn, for the personal endorsement of vaccinations, and certainly the experience from the South Hemisphere was that the current variants of flu are very virulent and are having a significant effect on morbidity and mortality for those who are unvaccinated. So thanks very much for that.
Thank you.
I myself had a COVID vaccination, which I paid for because I wasn't eligible under the new criteria. And I think I'm not the only one. They are available locally for people who are outside the eligibility criteria, but at a cost. Thank you. So can we move on to ICB update, including new GP out of our service and winter update? And presenting this is Nigel Lee, Director of Strategy and Partnerships at SAPF and Chief Strategy Officer at NHS Shropshire, Telford and Wrekin, plus Claire Parker, Director of Strategy and Development for NHS Shropshire, Telford and Wrekin. Thank you.
Thank you, Chair. We've included a stakeholder update, which I think contains a range of different bits. So just selecting some key points. I'll check in with Claire if there's anything else she wishes to add, if that's okay. I think personally, just especially from South point of view, but across the elective providers, I think it is important to note about the continued improvements in elective and diagnostic and cancer weights. The 52-week position has decreased now by 97% over the past year, and we're in the top quartile nationally. The RTT referral to treatment target, that's the 18 weeks, has continued to improve and is now at the best point for 5 years, and that basically since COVID obviously impacted us. And also the cancer, what's called the faster diagnosis standard, which was a really important element for patients, is it now at just over 80% and is in the highest on record for our trust locally, and that puts us in the top half. I think whilst that in itself is important, especially if we relate to any resident who's waiting for treatment and a diagnosis, particularly if they're off work, that's if you look at the broader health and wellbeing. And of course, we know that people awaiting elective treatment may be more prone to needing some urgent care. So I think whilst elective is important, then it's important more broadly. Just focusing on urgent and emergency care, I know we had the winter plan presented by Gareth Wright from the operational team at this Health and Wellbeing Board last time, and also to the Integrated Care Board. The capacity plans at South, both at the Royal Shrewsbury and the Princess Royal, are on track, and certainly the new wards, for example, the modular wards, are scheduled to be open on the 8th of December. General practice, I think, is a really important element. We heard that in the brief. They are fully part of the urgent and emergency care plan, and there's some elements within the brief there on that. The same too with Shropshire Community Trust, the expansion of what's called the urgent community response, and also that community expertise at the front door to both signpost and support patients that could be better supported closer to home and or in their own home. The GP out of hours contract is now a few weeks into that, and the Health Hero, and they are delivering as expected, and certainly the support that they've worked very closely with the ambulance service for the Cat 3s and signposting has been significant. A couple of other points, if I may. The next one, and obviously I think we had MPFT, got Ben on the call. We obviously heard quite a lot about children, young people, and youth side there, and a reference to made that obviously CAMS is not the default here, but just to note that the CAMS service was obviously was retendered as major procurements need to be, and Midlands Partnership Trust were successful, so they will then be looking at the next phase of that redesign. And finally, if I may share, just to note, and I recognise that Simon Whitehouse briefed that last time, that obviously the continued work of the NHS integrated care boards, the clustering arrangement continues. A new set of exec appointments was the process was completed over the last couple of weeks, and they will start to take up roles from December. And colleagues may well have heard that nationally an agreement was reached between Department of Health and Social Care and the Treasury for a voluntary redundancy scheme. So that again is planning to be launched shortly. May I check, Chair, if that's okay? Anything else, Claire, that you wish to add?
No, thank you, Chair. I think that's everything, Nigel.
Thank you very much, folks. And clearly these improvements are very welcome. Is there anybody that has any particular comments or Ruth?
Yeah, a question actually on slide 8. The new CAMS service has recently been retendered, and I know it's been redesigned and been re-awarded to the Midlands Partnership Foundation Trust. So I just want to ask about what's happened to the waiting lists on there, and how will they be addressed? Is that, the same provider with a new service?
I don't know that level of detail, I'm afraid, Ruth. I don't know whether Claire may know, or indeed I don't know if Ben's dropped off. Oh, Ben's still here, sorry.
There is there's an access and management plan for the waiting list at the moment, and that's continuing. That's been really successful, actually. So we put additional funding into that to make sure it was managed pre-procurement and during the mobilisation phase. But the new model of care will address I mean, Ben will be able to talk about it in a more triaged approach, those young people that are on and moving into the service. So Ben, if you can answer some of those bits, but definitely the waiting list is being managed at the moment.
Okay, thank you.
I'm not massively close to the detail, but the problem generally resides around the neurodiversity services. Just like everywhere in the country, we've had triple-digit increases in demand, which are very difficult to manage. But there is a programme of work looking at changing how that's accessed, trying to put support in earlier for children, young people and their families who are on that waiting list. And as I say, there's this 3-year transformation which will kind of run alongside this to deliver that. We've conducted a significant sort of needs analysis around neurodiversity services, and there's kind of work ongoing to implement the findings from that, basically. We know it's really difficult. I can speak from personal experience how difficult that can be. But you know, some of these issues reside in a sort of holistic approach, really, and I think that's all part of this desire to look at a kind of shift left and how we can kind of manage that demand a bit better, perhaps moving away from just being a diagnostically led sort of approach for neurodiversity services.
Thank you very much. Ruth, do you want to come back for a second?
Well, on that same slide, I'm just looking at the all-age autism and ADHD review, and to remind partners that December Cabinet will have the Shropshire Council all-age autism strategy presented. So I think it's important that Health and Wellbeing Board members have a look at that, please, when that's published.
Thank you.
Thank you, Chair. I think I would just also, picking up the CAMS recommissioning aspect, I think it would be worthwhile the Health and Wellbeing Board being citing perhaps a report coming back in the new year before the new service goes live in April. I absolutely accept then what you're describing, and I was part of the recommissioning work around developing the specification, and I think it's fair to say that everyone involved in that work, both from Shropshire and South Weekend, are looking for quite a different model, a paradigm shift as you described. I think our challenges are how we ensure that shift happens swiftly. So I think personally, as a board member, I would like to see the implementation plan for that. I know it's early days at the minute, but I think we need to cite that from a governance perspective. I know it will go into other areas as well. The Send AP Partnership Board are equally interested in the site on this, but I think it's such an important, crucial issue that shift to the left, as you described, that early intervention prevention, is mapped, modelled and understood. And the pinch points, I think colleagues previously in areas have described, we're going to have some wicked issues that we're going to have to resolve collectively around this. We need to be cited on what those wicked issues are at the earliest opportunity so we can do something about those.
Thank you, David. We'll put that request in on behalf of the Health and Wellbeing Board. Thank you. Is there anybody else? Thank you very much, Nigel. From the chair, I would really appreciate if amongst the slides there was an expanded area on urgent and emergency care and some of the parameters that we know are published on a regular basis. In particular, items such as the numbers of people seen in the A&E departments, the waits, the 4 and 12-hour waits, the delayed discharges, and some of the other really important parameters, including perhaps mortality going through that service, because these are vitally important items. And if they're available on a regular monthly basis, then I think it would be really appreciated.
If I may, I'll invite Gareth Wright as the lead on that to collate those, and we can ensure that they're available. As you will know, a number of the the specific acute performance indicators are obviously publicly available each month through the board. So there's lots of information that is relevant and can be brought to this board.
So that's great. Thank you, Nigel, because bringing it all together, I think it is very useful, particularly for this board to see what the trend is and to hopefully see these improvements. Thank you very much. And so the recommendation was that the board should note the content of this update. And thank you very much, Nigel and Claire. And so we move on to the chair's report. And so as co-chair and portfolio holder for Health and Public Protection of Shropshire Council, I want to take this opportunity to update you on Shropshire Council's current financial position and the steps we are taking to address the challenges ahead. In particular, to offer reassurances in terms of the impact on our joint health and wellbeing strategies, and propose a further discussion with partners on our future plans and any implications as these emerge. As you know, we declared a financial emergency in September of this year, and I appreciate that this may have left staff, partners, and the public feeling uncertain about the council's future. Firstly, let me reassure you that we are doing everything possible to regain financial stability and protect the services we deliver. After a worsening financial position witnessed over recent months, we have completed a detailed review into all areas of our budget. This has enabled the true scale of financial challenge facing us to be uncovered. A report which outlined our financial monitoring position, based on information to the end of September of this year, was presented to Cabinet yesterday. Early indications show that we may overspend by £50 million by March 2026 if no alterations are made. Over the last few months, the Council has been working hard across the organisation to stabilise our finances as quickly as possible. Our focus is on stopping spending, reducing costs where possible, increasing income, and delivering the savings we have already committed to. Alongside these immediate actions, we are also putting in place longer-term plans to ensure the Council's sustainability for the future. I want to assure partners that our priority is to maintain essential services and support our communities during this period. We have been in ongoing discussions with the Ministry of Housing, Communities and Local Government, seeking both immediate and longer-term financial support. While our main request is for the funding needed over the next 3 years to invest in transformation and stabilise our budget, we have also asked for urgent help to ensure we can continue to deliver services until March 2026. We expect to apply for longer-term funding in December of this year and hope to hear a decision by February 2026. We are awaiting confirmation regarding our request for immediate support, and we'll keep you updated as soon as we know more. We are making tough decisions to reduce spend, increase income, and protect our most vulnerable residents. Some services may be affected, and there could be changes to fees and charges as we prepare for our next budget. Where changes are proposed, we will produce equality and social inclusion impact assessment alongside and share these with partners and the public. We will also continue to lobby for fair funding and ensure that the unique challenges of rural authorities like Shropshire are properly recognised. We know this news may be concerning, but we want to assure you that the Council is fully committed to working through these challenges with transparency and collaboration at the heart of our approach. We greatly value your partnership and support, and we will continue to keep you informed as the situation develops going forward. As we continue to develop our long-term plans, including our corporate and partnership plan, which will seek to ensure that despite our challenges, we can make Shropshire Council sustainable, fulfil the promises the administration made in our new direction paper, and create a council we can all be proud of. Especially, the new direction paper specifically sets out our continuing commitment to health over the next 4 years. We are committed to working in partnerships in local communities where possible. We recognise the importance of our public places in Shropshire, and will continue to focus on prevention and address underlying inequalities in our diverse communities, which deliver not only better outcomes, but have a clear benefit to our long-term financial sustainability. We retain a strong focus on prevention, early intervention, and reduced demand. Over the next few months, we welcome the opportunity to bring updates to partners and engage with you all more directly on how we can achieve these ambitions. Thank you. And so we'll move on to the ship update. Rachel, I think you're going to provide that. Thank you.
Thank you, Chair. This report's just for noting, so it's there in the pack for information. If anyone has any questions, I'll take them, but otherwise it's for noting reference to a few of the items on the ship in today's agenda.
Thank you very much, Rachel. And clearly, during this morning's discussions and papers, it's been absolutely crystal clear how vitally important the ship is in these processes. Thank you. And so, ladies and gentlemen, I'll call an end to this meeting of the Health and Wellbeing Board. Thank you very much, everybody, for your attendance and contributions.